Ontario's first ever patient ombudsman has released her first ever report on the complaints we have about our healthcare system and how she's tried to resolve them. Christine Elliott started receiving those official concerns last summer, and nearly 2,000 complaints later, she's now able to tell us more about what those problems were. And we're pleased to welcome the former MPP, now patient ombudsman for Ontario, back to our studios. Nice to see you again, Christine.
Good to see you.
Let's just go through some of the background that you outline in the report to set the table for the discussion to come. So, Sheldon, if you would, let's bring these up. As we indicated, nearly 2,000 complaints in total, more than 1,400 by phone, more than 500 by writing, and you say 75% of them were resolved without a formal investigation. Let's find out who sent these complaints. 37% of the complaints came from patients, but almost 30% from substitute decision makers, 23% from caregivers, and 6% from family members. Written complaints by the type of health service organization, we overwhelmingly had concerns about public hospitals. 70% of the complaints related to hospitals, 19% about home and community care, and 11% long-term care homes. All right, let's get into this. Given that this is your first ever report, we want to get a better sense of the kinds of problems you were dealing with, 75% of which you tell us were resolved without a formal investigation. So just give us sort of like, I don't know if this is possible, the most typical average complaint that you got and how you then set about to resolve it.
Well, one of the complaints that we receive is with respect to inappropriate transfers or inadequate discharges from hospitals. So there's a lot of people who are called alternate level of care, patients in hospitals who don't need to be there, but they can't be at home either because their needs are considered too complex. So they're waiting for a long-term care bed, and in many parts of Ontario, there aren't any. And what we're hearing from people is that they're given the information when a bed does become available at the last possible minute. They're not given all of the information that they need to make a good decision, not given enough time, and not given the information in writing because maybe only one family member will be there. Other people need to know about it. So I think there's a lot of work that could be done by the hospitals, even in the midst of the bigger picture with a lack of long-term care beds and so on. But adequate communication with the patient and family could really help make things a lot better.
And how do you, as the ombudsman, intervene to resolve that?
Well, we would, first of all, we take the information from the patient, and then we go to the hospital and say, this is the complaint that we've received. What do you have to say about it? And then we try and make a resolution. If there might be a situation where people can go a little bit further away from home, if the family members are all right with that, or they may need further information in order to make a good decision. A lot of it is just sort of basic communication.
I can imagine, though, that when you or your staff show up at the hospital, you're like the last person they want to see.
Well, initially, I think it was like that. I think people probably thought, oh, great, another person to come and look over our shoulder and second-guess our decisions. But what we've really tried to do with the health sector organizations, hospitals, long-term care homes, and home care, is to say we want to work with you. We want to collaborate with you and with the patients to be the bridge that brings the two sides together. And we're not here to point the finger of blame or say we got you. It's not that at all. It's about what can we do to resolve this individual person's complaint, but also look at suggestions we can make to the government about how we can make the health system stronger. So in that way, I'm helping them as well.
One of the things that you do say in the report, and this is a toughie, is that people are afraid to advocate for themselves at these institutions because they fear reprisal by somebody, you know, who knows, a doctor, a nurse, whatever, in the system. Are they right to have that fear?
I think in the vast majority of the cases, no. But when people come to us and tell us that they're afraid and they don't want to even give us their name, we know that they sincerely believe it. So I don't think there's an easy fix to this, but I do think that those organizations that are really open and transparent and that they look at these complaints not just as a complaint, not just as a negative, but as a positive, as an opportunity to do that continuous quality improvement to constantly get better, then I think that it can be turned into a positive, and that's why we encourage people to look at it.
As we indicated, the hospitals were the biggest area of concern, and Sheldon, let's go to the top of page 3 here and put this graphic up about hospitals under fire. We saw that more than 6 million emergency room visits across the province of Ontario took place in the year 2014-15, the last year I guess the figures are available. Hospitals performed 1.2 million outpatient surgeries in that year, and hospitals performed 350,000 inpatient procedures also in that year. Now, I guess the thing we've got to do is put that in perspective. given that most of the complaints were about the hospitals, but the hospitals are performing an enormous number of transactions with patients, what conclusion do you come to?
Well, I think it's just the fact that there are so many people cycling through a hospital. It's just natural that you would have more complaints. But then there is also that fear of reprisal that we just spoke about, that people are afraid to speak up. That happens more in long-term care and home care. So I think that people are concerned about bringing complaints forward in those other two sectors. And there's other ways they can complain. There's the Ministry of Health call center. There are inspections that are going on and so on. So I think it makes sense that we would get mostly complaints from hospitals.
But I wonder if hospitals, if somebody from a hospital association were here, would they say millions of interactions between patients and our institutions, 1,500 complaints, we're doing okay? Is that a reasonable inference to draw?
Well, probably, but the other thing with the hospital complaints is very often we'll receive a complaint and it's not clear from the beginning whether the complaint is about a decision that a physician made or whether the hospital made the decision. So we almost have to start a preliminary investigation just to see if we have jurisdiction or not. In many of those cases, the complaints where they may deal with a physician complaint have to go to another organization. They have to go to the College of Physicians and Surgeons.
Yeah, we should clarify that, because you don't have carte blanche to go wherever you want for your investigations, right?
No, not at all. Any complaint against a regulated health professional has to go to their relevant college, CPSO, College of Nurses, whatever it happens to be.
Okay. I want to be careful how I ask this, but I'm assuming the reality is a number of the complaints that you get could be described as vexatious or made by people who have a lot of troubles, maybe mental health issues, and the complaints really have no merit at all. Do you have a guess as to what percentage of the complaints you got would fit that description?
It would be fairly low, I would say, maybe 5% of the complaints we receive. But what is really important is that you listen to every patient call, because by the time they come to our office, it's the last place to go, and they're pretty angry and frustrated. And so it'll often take maybe up to an hour in a conversation with somebody to really understand what the nature of their complaint is. So while it might start out sounding like a vexatious complaint, by the time you finish the conversation, you really understand what the points are that the person's raising. So my early investigation staff are very well trained at that, very patient, and they know that it's important to give everybody the respect and dignity that they deserve.
Did you find that in many, many cases, people just want to be heard?
Yes, very much so. I think that there are many cases where they feel that nobody has ever listened to them before. By the time they get to the hospital patient advisor person, that they feel that they're just being sort of pushed aside. Doesn't happen to be true in a lot of the cases. I found the patient advisors to be very comforting, very great and helpful. But some people do feel that way, and so it's important for them to tell us everything they want to tell us. And so that feeds into their whole story and helps us as well understand the full nature of their complaint.
Now, you pointed out a second ago that if a patient has a concern with a doctor, you're not the avenue. They got to go to the College of Physicians and Surgeons and so on. So you don't have carte blanche to look at everything. Now that you've been in the business for, I guess, about a year and a half now, almost a year and a half, do you think it's time to change your mission? Go back to Queen's Park and recommend that you have your powers enhanced or something like that? Or are you okay with where it's at?
Well, I have already gone on the record, yes, in the discussions about the Patients First Act, to ask to be made an independent officer of the legislature, because I'm not right now. That hasn't happened yet.
So let's understand that. Yeah, unlike the ombudsman or the Environmental Commissioner of Ontario, who report to the legislature, you report to?
The Minister of Health.
Minister of Health.
Yes.
So that's different.
It's different. In the minds of some people, when they make their complaints to us, it's a concern about the level of our office's independence. However, I can tell you that we do operate independently. We do come to our own conclusions about fairness and unfairness. No one has stepped in our way or tried to curtail our activities. So we do operate independently.
That's important to put on the record. The Minister of Health or no one from the Ontario government has ever come to you, officially or unofficially, and said, ...
No, they have not. They have not. So we are allowed to do our work privately and independently.
If you have that kind of relationship right now, why do you think you need to be on a level of the others and report to the legislature as opposed to the minister?
Because in the eyes of some patients, it's really important because they want me to be as independent as possible, and they say to me, you should be an independent officer of the legislature. So it's really their feelings about it, not my own, that I'm bringing forward.
And again, earlier we said 75% of the cases are resolved without a formal investigation. Resolved to everyone's satisfaction?
Not always, not always. Our test is fairness. So I'm not a patient advocate. I don't automatically take the patient's side. What we do is take the complaint that the patient has brought to us. We take it to the hospital. They give us their answer to it. There may be more work that we need to do to interview some witnesses or whatever. But at the end of it, we come to a conclusion as to whether there has been unfairness in healthcare for that complainant. If we don't see any evidence of unfairness, we will write a report to that effect and our file will close. So in that case, the complainant likely isn't going to be any happier with us than they were with the hospital. But that's the test we have to use. If we do see evidence of unfairness, then that's where we will do our work to figure out what could be done to resolve that person's issue, and are there any recommendations that we could make to the government to make the system better as a whole.
Do you have to, at some point, get a better understanding of what percentage of your customers actually walk away satisfied, as opposed to just having their case done with?
Yes, yes, and we can tell if we're telling them that we're closing their file and they don't see any reason for it, we know they're not going to be very happy. But we are devising a specific method of following up with patients and family members now that we've got our first year completed. We know that's really important as we are following patient satisfaction with hospitals and other healthcare organizations. We need to know whether they're happy with us if we're doing the work that we should be doing.
This was a banner year for you for more than one reason. Yes, your first year as the patient ombudsman, but the patient ombudsman, in what can only be described as the height of irony, found herself a patient in the Ontario healthcare system for a very long time. What happened to you this past summer?
Yes, I had an accident at my cottage where a stair basically became unpinned and flipped me into a wall. So I ended up going to the Haliburton Hospital by ambulance.
What happened to you when you hit the wall?
I became unconscious for a period of time. I don't even know how long. And then my family found me in the morning and called the ambulance, took me to the hospital, and then
You were out cold?
I was out cold.
For hours?
Yes.
With no one attending to you?
No.
They found you the next day?
Yes, yes. And they called the ambulance, took me to the Haliburton Hospital, then I was airlifted by Orange Air to the trauma unit at Sunnybrook, and I stayed there for about a week to 10 days. And then I went to Bridgepoint Health for rehabilitation for about a month. So all of July and half of August, I was an inpatient in hospital.
And how did the patient ombudsman's treatment go as far as the patient ombudsman was concerned?
Extremely well. I was very well treated. The care was wonderful at all locations. I don't remember Haliburton, but I'm told it was very good. But both at Bridgepoint and Sunnybrook, I was very well cared for.
That's crazy.
Well, wasn't expected, that's for sure.
No kidding. No kidding. How do you feel now?
Great, great.
Are
They
you-
tell me I should be 100%. It'll take a few more months, but so far I'm back at work and things are going well.
But you got a heck of a bonk on the head, I guess, eh?
I did. I
Concussion?
broke a few bones. Head injury, so
Okay.
I'm very fortunate, but I had very good care.
Well, welcome back to the job.
Thank you.
Part of your mission also permits you to undertake, at your own initiative, investigations of the healthcare system. And I wonder if you've done any of that yet.
We haven't yet, because it's just been 1 year. We were really just getting up and running. But what we are doing is keeping our eyes on about 10 to a dozen issues that look like they may be systemic issues. They're happening in different parts of the province. So we want to collect the evidence to ensure that it is something worthy of a systemic investigation. And so I expect that next year we will get into more investigations of both specific complaints as well as own motion complaints.
Can you give us a hint as to what some of those areas of investigation might be?
I can't really reveal that now, but I think it would be consistent with some of the themes that you've seen in our first report, some of the transition issues, some care issues. Communication is always a big issue. Probably about 2/3 of the complaints we receive in the office have to do with some element of communication or perceived lack of communication.
How many members of staff have you got?
We have 16 people in our office.
Is that
right
adequate
now.
to handle 2,000 complaints a year?
They're very busy. They're very, very busy. We have 4 people on the front lines, the early resolution officers, 3 investigators, lawyer, myself, people doing administration work. I think as time goes on, because we were busy in our first year, we probably will need more help, because the other function that we're performing right now is almost a navigation function for complaints where we don't have jurisdiction, but we know people need help. We don't want to just tell them, sorry, we can't help you, and leave them like that. So we will do our research if we don't know right away where they should go, and then call them back with a name and a telephone number. So that's the other part that I don't think was really anticipated when our office opened, but it's something that takes up maybe a third of the time that we have.
Because I would assume, I mean, you've only been in business for a year, and
Right.
you know, I would assume as more people find out about you, you will take more complaints as the years go on.
Yes.
So 2,000 in your first year, but you're anticipating more next year.
Absolutely, because there's still a lot of people and groups in Ontario that still don't even know we exist. So that's my job for next year, is to continue to travel, to speak with patients and families, and to let them know that we're there to help them.
In our last couple of minutes here, I want to focus on something a little odd, and that is the title of your report. It's called Fearless.
Yes.
Why did you call it that?
Because we want everybody to be fearless. This is a time of change in healthcare. We're talking about developing a patient-centered system of healthcare, which can mean everything or it can be nothing. It can just be a meaningless saying. We want it to mean something. So we want complainants, patients, and family members to be fearless in bringing their complaints forward without fear of retaliation. We want health sector organizations to be fearless in receiving these complaints and turning them into something positive. And we want our office to also be fearless to do our work, to make recommendations on whatever has to happen, and not to be held back. We need to be fearless in making those recommendations to the Minister of Health, to Cabinet, because people have told us that they expect us to be the conduit for the patient voice to government. So everybody has to be fearless if we're going to make this system truly patient-centered.
It's an interesting choice of a title, because there are probably, I mean, you're never more fearful than when you're in the healthcare system, right? When you're suffering
right.
from bad health. It's, is it an unusual thing to ask us to be fearless in sticking up for our rights when we're dealing with a system that is hard to navigate, that we don't understand, and we're scared because we're sick when we're in there?
Well, we consider people that do come forward to be very courageous and very fearless, because they often have health issues they still have to deal with. They had a negative experience in the hospital. They just walk away and don't want to say anything about it. But things can't be improved if nobody knows about your bad experience. So we need to know about it so that we can make recommendations and be your voice with government.
Gotcha. That's Christine Elliott, Ontario's patient ombudsman, and for a time, a patient as well. It's good to see you again, and we look forward to having you back next year.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.